You reach for your morning cup of tea, but your fingers tingle, go numb, and simply won't cooperate. That persistent tingling and pain quickly bleeds into the rest of your day. Typing an email becomes difficult, turning pages is frustrating, and the ache wakes you up. For adults over 50, it actively blocks you from executing your work and enjoying your retirement. This diagram shows the anatomy of carpal tunnel syndrome. Right here in your wrist, a band of tissue called the carpal ligament presses down on the median nerve. That mechanical compression cuts off normal sensation to your hand and fingers. When wrist splints and steroid injections stop working, a short surgical procedure to release that ligament is highly effective. But patients in the UK face a stark choice: wait for a free procedure on the NHS or pay thousands to skip the queue and access a private clinic immediately. You have to decide if getting your dexterity and sleep back right now is worth writing a substantial check, or if you can simply manage the daily discomfort while the long months tick by on a waiting list. To help you navigate this decision, we are drawing on a comprehensive new guide brought to you by the Best of Health, the UK's trusted resource for over 50s making critical healthcare choices. We are going to systematically break down the 2026 data. We will map out exactly how much private care costs, how long the NHS waiting lists actually are, and the differences in surgical techniques. The medical quality of the surgery is not the deciding factor here. Whether you use the NHS or a private hospital, both pathways boast an identical 85 to 90% success rate. We are laying out the numbers objectively, so you can look at your budget and your daily pain levels side by side. Because the surgical outcome is reliable in both sectors, your choice is purely logistical. You are deciding whether it makes more sense for your life to spend your time or your financial capital. Let's look at the NHS pathway first. Your GP refers you to a hand specialist, and the entire process, from consultation to surgery and aftercare, is free at the point of use. The trade-off is the waiting list. Depending on your local trust, the wait from referral to the operating theater varies widely. It can stretch from 18 weeks to over a full year, meaning you must manage your symptoms through another 50 to 60 weeks of daily disruption. This table compares the routes using 2026 data. Privately, standard procedures cost £2,500 to £4,500 across groups like Spire and Nuffield. This secures rapid access, completing surgery in 1 to 3 weeks. Many clinics bundle physiotherapy into one upfront fee. If you carry private health insurance, your policy might cover the procedure entirely, provided you've met your waiting periods and the condition wasn't pre-existing. Choosing the self-pay route means treating your savings as a tool to buy back over a year of pain-free dexterity and peaceful sleep. Regardless of who pays for it, the surgery itself is a day case, taking only 15 to 30 minutes under local anesthesia. But the surgeon will use one of two distinct techniques. This diagram compares both approaches. Open release, on the left, uses a larger palm incision. It costs less but requires slightly longer healing. Endoscopic release, on the right, uses smaller wrist incisions and a camera. It offers faster recovery but costs more. Deciding between open and endoscopic surgery requires balancing your financial budget against exactly how quickly you need your hands performing high dexterity tasks again. Once the ligament is cut, the pressure on the median nerve drops. Many patients wake up to find the tingling and numbness are already gone, but nerve healing takes time. Regaining your full grip strength and complete sensation requires 6 to 8 weeks of patience. During that window, you have to do the work. You must complete your hand physiotherapy exercises and consistently wear a protective splint at night to keep the wrist straight and prevent re-injury. Consult your GP before surgery. You must exhaust conservative options first. Ask about local NHS waiting times and if a nerve conduction study is needed. Getting these answers early ensures that by the time you sit down to choose between the public or private pathway, you know exactly what you are treating and what your constraints are. The clinical data confirms that releasing the carpal ligament effectively cures the problem in the vast majority of cases. The only variable you have to solve for is time. This flowchart maps out the two logical routes based entirely on how the condition is impacting your daily life. If your symptoms are manageable, you are retired with an adaptable daily routine, and your local hospital can perform the surgery in under 26 weeks, staying on the NHS list is the most practical choice. Conversely, if you are self-employed, forced to drop your hobbies, suffering severe sleep disruption, and facing a weight pushing towards 60 weeks, the private route offers an immediate exit. For anyone over 50 who relies heavily on their hands to earn a living or maintain their independence, spending the money to minimize downtime makes clear financial sense. Whether you endure the wait to keep your savings intact or spend the money to get back to work by the end of the month, investing in your hand health is a positive step toward an active future. For more definitive guides on carpal tunnel surgery, costs, and choosing the right care for your lifestyle, visit The Best of Health at thebestofhealth.co.uk. By accurately calculating what your time is worth compared to your budget, you can take decisive action today to get a pain-free, fully capable grip on your active retirement.